歡迎大家嚟到今日嘅簡報會啦。
Welcome to the press briefing. Secretary for Food and Health, Dr. Sophia Chan, will brief you on the Prevention and Control of Disease Requirements and Directions Business and Premises Amendment Regulation 2020. Professor Chan, thank you. Friends from the media, in order to regulate activities involving gathering of crowds and to protect public health and to control the COVID-19. This morning, the EXCO had a special meeting to endorse the enactment of Prevention and Control of Disease Requirements and Directions Business and Premises Amendment Regulation 2020. And under the Prevention and Control of Disease Requirements and Directions Business and Premises Regulation 599F, and also the above mentioned amendment regulation issue the latest directions starting from 6 p.m. Until that is the 1st of April to the 15th of April at 5:59 p.m. for 14 days were required at karaoke's and karaoke activities in eating premises and clubhouses be closed. We will also close mahjong tingka premises and suspend mahjong tingka activities in clubs and restaurants. 3. To close establishment commonly known as club or nightclub that is open late into the night, usually for drinking and dancing or other entertainment. 4. Anyone who is in a beauty parlor, a clubhouse, or massage establishment where feasible should wear a face mask at all times. 5. To allow someone before one is allowed to go into a beauty parlor, massage establishment, or clubhouse, they must take their body temperature, and these premises should also provide hand wash sanitizers. And any premises supplying food and drinks for consumption inside the premises, then the karaoke and mahjong tingka activities within the premises must be suspended. For premises that breach these requirements, the person in charge can be subject to a fine of level 5 fine that is $50,000 and imprisonment of 6 months. From time to time, we will review the feasibility of these measures and make adjustment where appropriate. So we'll closely monitor the development of the epidemic and also the development of events and also the effectiveness of these new regulations. The amended regulation will help to further promote social distancing. Of course, I want to remind the public once again to stay in as far as possible and avoid attending gatherings or meals, and please ensure suitable social distancing. And I'd like to appeal to the public once again to observe personal and environmental hygiene at all times. They will be very effective in the prevention and control of the disease and spread of the disease in the community. On a personal level, when you have upper respiratory tract infections, when in crowded places, or when inside means of public transport, you should wear a face mask and ensure good hand hygiene, in particular before touching your face, your nose, and your eyes. Questions, please use a microphone, and before you ask questions, please identify the organization you belong to, and you can only ask up to 3 questions. Good afternoon, Secretary. I'm from TMHK. A few questions. First, at 3 p.m., the amendment regulation was gazetted, and then it came into force. at 6 p.m. However, the press release was only released at 5:56 p.m. Within 4 minutes, how can you expect the industries to follow the new requirements? Some shops are closed by 6 p.m. and some could not do so even after 6. Why have you caused people to be caught inadvertently? And how come some people could comply with your new requirements even before the effective time? And the requirements and directions have yet to be gazetted. So is there any proper legal basis for enforcing the regulation? Now, you refer to establishment commonly known as club or nightclub. They will be regulated. Are you worried that bars will fall into this category to the effect that they also have to be closed as well? Thank you. Thank you for your question. The Executive Council only met this morning, and then the Chief Executive in Council decided to further amend the regulation to add more requirements and directions. I apologize, we were in a rush, but in dealing with emergency legislation, we will first try to advise and encourage the industries to follow. Given the very short notice, we understand that the industry takes time to be prepared, and our law enforcement agencies will bear this in mind. And of course, when preparing the regulation and the Executive Council discussed the draft, and then when we came to a decision, we prepared the press release. We hope that the emergency regulations can be implemented as soon as possible, and a lot of things were done simultaneously, so there is no problem with the jurisprudence of the regulation concerned. Now we're going to close establishments commonly known as club or nightclub that is open late into the night, usually for drinking and dancing or other entertainments. So mainly such establishments. For bars, when we enacted Cap 599F, bars have been regulated. Whether it be catering premises and places where crowds gather, and a further closure of the 3 types of premises named here, and even for places that are not yet closed but with directions issued, we will closely monitor the development of the epidemic. We don't rule out further regulations and measures in the future. What about the establishments? There are many clubs or nightclubs. Bars are being regulated under Cap 599F. The lady in the last row.
Questions. So why are the 3 kinds of venues, including beauty salons and massage parlors, allowed to remain open, especially when there's a beauty salon staffer who has come down with the virus today? And second question, so it seems a bit rushed because the government announcement did not come until 17:56, so that practically gave the 3 types of venues 4 minutes to close. So why was the arrangement not announced before it's gazetted? And thirdly, at 3 p.m., we know that the Gazette said the arrangements would take effect from 3 p.m., but then the government clarified that the arrangements will not become effective until 6 p.m. So that's a bit confusing to the public, especially the practitioners. So could you explain why would that be the case? Thank you.
Okay, thank you for your questions. First of all, I think this is a emergency regulation. So this morning, the regulation was discussed at the Executive Council meeting with the Chief Executive and decided that we are going to go along this direction. Why it is 3 p.m. and also 6 p.m., it is in fact something technical. So at 3 p.m., I think we probably further, my colleague, Deputy Secretary Howard can explain a little bit more, that at 3 p.m. we have to publish this so as to provide the Secretary for Food and Health the authority to do it. So this is the step one. And then step two, then we decide a time to have these regulation and also directions effective, and that is 6 p.m. But as I've said, this is, of course, time critical given it is an emergency regulation and also in a public health emergency. So therefore, on the one hand, we want to start it as soon as possible, but on the other hand, we also understand practically given such a short time, these premises may have difficulties or very rush in terms of closing or preparing. So in the beginning, I think in terms of the enforcement, it would be more providing advice, and the enforcement colleagues would obviously take into consideration these factors. I don't know whether Howard can supplement.
Yeah, sure. The government has actually made two pieces of an announcement today. First, we decided to amend the regulations on the 599F. The amendment regulations actually add 6 types of premises onto the scheduled premises in the schedule, so that the secretary could then issue direction to direct regulate the operations of these scheduled premises. So the amendment regulations must come into effect first before the secretary has the power to issue direction. So that's why after the Executive Council has made the amendment regulation today, earlier on the day, we need to put the amendment regulation into effect. Now, only after the amendment regulations come into effect, then the secretary has the power to issue directions to certain premises. And the secretary has decided that 3 types of premises will need to be closed, i.e. nightclubs, the karaoke premises, as well as the third is the massage.
Spa.
Yeah, and the third is the Marja Palace. Yes, and the remaining 3 type of premises, the secretary has decided to regulate the operations of these premises such that they could implement infection control measures. So it does require some time. We are trying our best to, as soon as the amendment regulation is put into effect, then we'll issue the direction by the secretary. Now, granted, the time is very tight. We understand that all the affected business may not have sufficient time. Our enforcement agencies will take this into account when they begin to start to inspect these premises for the compliances. Now, of course, as the secretary has mentioned, we will try our very best to educate and also to communicate with the premise owners concerned to ensure that they were fully compliant with the new regulations.
好，下一條。
Sorry. Oh, okay. So I think in deciding which are the premises that we are going to close temporarily for 14 days, first of all, I think we look into the risk. So it is risk-based. As I think I mentioned earlier, there are all these premises whereby there are activities or human activities that have more gathering opportunities. So I think these are high risk, and so therefore we choose to sort of having closure of these premises. We also would look into the confirmed cases, and also all the clusters. So those are one of the information sources that we are relying on. On the beauty parlor, and also this time we have added actually 3 types of premises. Beauty parlor is one of them, because we think they also have some risk. At this point in time, we give directions in the infection control measures, such as taking temperature before they enter the premises, that they have to wear masks all the time, wherever possible, and also to have sanitizer, hand sanitizer, so that they can keep or maintain hand hygiene. So I think, if they keep these measures, these are the initial steps. But of course, we will continue to monitor the situation, and we would not rule out any further measures, such as closure or other measures, if the situation changes.
好，下一條。呢邊第2行白色衫位男士。
The second row, the gentleman in the second row, I'm from commercial radio. You have mentioned beauty parlor. You said people should wear a face mask. Well, when you go to a beauty parlor, you would like to get facial treatment. How can you wear a face mask here? So how are you going to enforce this requirement? And also, since the 28th of March, gyms and cinemas were ordered to close, and now you have another group, another 6 types or 3 types, which are closed for 14 days. And then we have different groups of premises subject to the 14-day closure order. How can you make sure that the communication chain of the virus can be stopped? Thank you for your question. Concerning the requirement to wear a face mask in a beauty parlor, we understand that for certain procedures to be carried out, people may not be able to wear a face mask, but at least the service provider should wear a face mask if the client cannot. So we are saying that under suitable circumstances, a face mask should be worn. At least those people who are not in the course of receiving any treatment or service should wear a face mask. At different times, we have implemented different infection control measures. This is part of our efforts to respond to a changing situation of the epidemic. And this is about the legal authorization for the Secretary to take into account the circumstances and introduce enhanced measures. We'll closely monitor the situation. We want to make sure that people will not gather in big crowds, and people will not congregate in risky situations or in risky premises, resulting in infection risk or an outbreak. Among the confirmed cases, we have seen situations that we would like to put a stop to. And after the amendment regulation comes into force, we will monitor the compliance situation. If people exercise self-discipline and are generally compliant, like what we have seen in eateries, restaurants, and catering establishments and their patrons, the self-discipline level is on the whole good. Therefore, in assessing whether we need to introduce more stringent measures, this will be taken on board. Of course, we have to look at scientific data as well.
例如嗰啲
such as the dispersal and gathering of crowds and the overall situation in the increase of confirmed cases every day. That gentleman in blue, I'm from Apple Daily. Secretary, in the first round of measures, karaokes were not included. As a result, there is a cluster of cases involving a karaoke. So the amended regulation will plug the loophole. And then there was no control over beauty parlors. And just today we have a confirmed case involving a worker in a beauty parlor. So aren't you just doing it bit by bit? Why don't you adopt a more general approach? And now, when it comes to a gathering of crowds, well, yesterday near Prince Edward, when policemen were enforcing the law, policemen asked the members of the public to stand together, and then afterwards accused them of breaking the regulation, and they were given summons. So is it against the principle of your regulation? Well, after the announcement of the first round of measures, premises that are supposed to be closed are now closed, but for a golf course, the one in Pak Shek Kok is still in operation. So, Secretary, are you aware of the type of license held by the Pak Shek Kok golf course, and is it required to close given the current situation? Now for the Pak Shek Kok golf course, I'll see if my colleague has further information. Any measures to control and prevent the disease is to be implemented swiftly. Whenever we see any change in the epidemic situation, we will increase or enhance measures. I think this is an approach, our usual approach in dealing with public health and public health risks. Of course, to be able to respond swiftly is important. You may say that we only gave very short notice. In fact, last night we were already prepared, but we could only brief EXCO this morning, and the measures are now launched immediately. So we've been responding very rapidly to the new situation. As regards whether things can be done in advance, I think the important thing is to be vigilant. If we have done too many things before there is a need, will also be criticized. So we have got the authority in the legal framework, and when we need to respond swiftly, we have the legal means to deal with the situation. So we will closely monitor the situation in taking action. As regards advising the industries, I think all legislation will come with enforcement and penalty. I think members of the public would expect the industry to comply with the regulation. In the initial stage of implementation, we will issue advice or warning. But if a certain premises or a certain industry repeatedly breaches the regulation, then law enforcement agencies will have to enforce the law. With regard to the Whitehead Club, now outdoor premises are not regulated under Cap 599F. However, any such premises that admit members of the public, then it is regulated under 599G. In other words, if members of the public carry out sports activities in these premises, then they have to comply with the regulation 599A, there should be no more 4 in a crowd, and there should be a distance of 1.5 meters between them. Good afternoon. I'm from Now TV. A few days ago, we asked whether karaoke should be closed, and your response was you gave some thoughts to that, but that was not necessary then. And then now we have this amended regulation. Is it to make amends? And now you have 6 types of premises in the amended regulation, but 3 have yet to be closed. Under what circumstances will you consider closing them, including beauty parlors? Because today we have a confirmed case related to an employee of a beauty parlor. So under what circumstances will you consider closing these 3 types of premises as well? And apart from mahjong premises, we have clubs with partitioned rooms where people play mahjong. I'd like to know whether these facilities will have to be closed as well. Thank you very much. Now, we have always kept a close eyes over the operation of karaokes. At first, under Cap 599F, we regulate such establishments, and back then we felt that it was appropriate. But now we've seen a cluster of confirmed cases in a karaoke, and we believe it is time to tackle this type of establishment as well, and that's why we've proposed to close these establishments. This is an example of our very swift response to the situation. And today, we've also introduced a preventive measure. We want to close karaoke establishments to be more thorough. We have to include this type in our scheduled premises first. So that there are legal procedures to follow. 3 types of premises are closed under the amendment regulation. Apart from that, by way of prevention, beauty parlors, clubhouses, and massage establishments are also included in the scheduled premises. Should there be further problems, or should there be more confirmed cases coming from these types of premises, we don't rule out the possibility. Well, because already included in this amendment regulation, will then be able to take further action very rapidly, including the closure of these types of premises. Under the amended regulation, the Secretary has issued directions. Now, for mahjong activities, apart from licensed mahjong tin can premises, there are also eateries that allow mahjong activities, as well as clubhouses with mahjong facilities. Such facilities will also have to close as a result of the amendment regulation. 2 more questions. That gentleman in a suit. Good afternoon. I'm Mad Dog Daily. Just yesterday, as a reporter from Apple Daily said, there were a few passers-by who had their ID checked by the police, and afterwards, the police accused them of gathering together, but they didn't know each other. For another restaurant, it was checked twice within 15 minutes. I'd like to ask whether the Department of Health has supplied any standards for enforcement.
咁其實咁樣係好唔理，對於防疫工作係好唔理想嘅。咁如果暫時衛生署係冇。
And this is very undesirable. And if the Department of Health hasn't got any enforcement guidelines, will the Department of Health advise the police proper guidelines of enforcement? Which organization are you from? Mad Dog Daily. Thank you very much for your questions. I recall that when we promulgated CAP 599G and CAP 599F, the Secretary for Security answered a similar question. In general, the regulations are for the sake of public health. So for CAP 599G, governing a crowd gathering, now we're saying that there should be no more than 4 in a crowd with the distance of 1.5 meters in between. And the principle is to ensure social distancing. And the reason for that is to break down the infection chains in our community, because we have ample evidence, whether it be from literature or in actual confirmed cases, to show that a crowd gathering can help to spread the disease and even cause an outbreak. Of course, in all scenarios, the law enforcement agencies will consider the regulation and also the overall situation in tackling the situation. As regards 2 inspections of a restaurant within 15 minutes, I'm not aware of that case, but I believe perhaps it's because different groups of law enforcement agencies went there. And the reasons are why there were 2 inspections within such a short period of time, and whether there was any non-compliance. Now, I don't have the information now, but I believe on the whole, we law enforcement agencies will ensure compliance, and they're familiar with the regulation. As for CAP 599F, it is rather clear. I understand that there are issues involved, such as a distance of 1.5 meters between 2 tables in a restaurant, and also effective segregation, and whether there should people should sit on alternate seats to ensure sufficient distance, and also together with body temperature checks and also hand sanitizers. These are very concrete. There may be issues by means of education, public education, and our Q&As and different platforms. We will make people aware of them. The regulation is to ensure social distancing. The purpose is not to arrest many and to accuse people of breaking the law. We want to hammer home this message to promote self-discipline. A few days into implementation of the regulation, I think members of the public are all very eager to chip in to fight the disease. Now, if we can all take care of our own health and other people's health, and to protect the community and our healthcare system and our healthcare workers. Now, if this spirit goes on, we are confident that we can win this battle.
The speaker's off mic. Well, I don't have any information on what happened on the scene. I've got nothing to supplement. The gentleman in the 3rd row. I'm from Hong Kong 01. My name is Kwong, Secretary. On the question of wearing face masks. Sometimes they have ancillary facilities such as a fraternity association or club-like facilities. What do you mean by wearing masks where practicable? the government is mooting the idea of setting up temporary hospitals. What is the what are the locations under consideration? We have many infection cases with unknown source. Can you confirm that we already have a community outbreak? With more and more confirmed cases, how can the administration ensure that we have sufficient hospital beds to take care of them? Thank you for your questions. The question is what is meant by where doing something where practicable. Well, we expect everyone to wear a face mask at all times. But as the reporter said, for example, in a beauty parlor, and if you are there to receive a facial treatment service, there's no way that he or she can wear a face mask. The service provider must wear a face mask, but the client may not be able to do so. In a club, you have many people, you have service providers, you have patrons. Generally speaking, we require everyone to wear a face mask. The second question is the general situation of the epidemic and also the reported temporary hospital idea. The HA has never used this term temporary hospital. Since March, we have seen drastic increases in the numbers of cases. Most of them are from returnees. We have a large number of people returning to Hong Kong, students and other people included. And we have seen more cases. Another factor is that we have started the enhanced surveillance, lab surveillance scheme for asymptomatic people. Everyone who returns to Hong Kong through the airport will be given a container for the purpose of returning a deep throat saliva sample. The ratio, the positive ratio is 1% at the moment. So 1% of them will be confirmed cases. So in the surveillance program for both symptomatic and asymptomatic people, we've seen the numbers going up, and many of these are imported cases. So this has brought about a tremendous pressure on HA in terms of the provision of isolation beds. We go for early detection and early treatment in our strategy. Yesterday, HA convened a press briefing to tell us that they now have 400 second-tier isolation beds in place. And these beds can be used by recovering patients who meet certain clinical criteria of doctors. You ask a question about providing a temporary hospital or using certain community facilities for similar purposes. Well, HA is doing the planning right now. Will the 400 second-tier isolation beds sufficient, or should more be provided? The HA is doing all the preparation needed. And the HA has also introduced other measures for people with symptoms. and if it turns out that they are not a confirmed case, they can return home. They will not be asked to go to a hospital first before discharge. At AWE, Asia World Expo, and the North Lantau Hospital, they have set up test centers for people returning to Hong Kong from overseas. These returning passengers would have their tests done there, and they will wait until for the results there. If it's a positive result, they will be sent to hospital. If it's negative, they can go home. This is what happens to both AWE and North Lantau Hospital. Some 700 people have been tested since the commissioning of these centers. 4 to 5% of these people turn out to be positive cases. So in other words, more than 90%, 95% of them can return home because the result is negative. If they were required to be sent to hospital, there would be a lot of cases for our hospitals. Apart from this triage system in North Lantau and AWE, they have a test element in this triage and test system at the A&E department, and they will set up cams and tents for conducting the test. If the result is negative, that they can return home, although they may have some symptoms.
方法。
So this is another way of triage. So the HA has adopted a multi-pronged approach. In the past 2 days, the situation hasn't been desirable, hasn't been very satisfactory. Some asymptomatic confirmed patients had to wait at home. The HA has done its utmost to prepare to ensure a turnover of beds to admit these patients. So the waiting time is much improved now. Given the current epidemic situation, they will have to consider different facilities to tackle different scenarios. They haven't decided on the type of facilities to use yet, but they will consider the type of wards that can be used for patients with different clinical conditions. They are discussing very proactively this issue. Now they have more than 600 cases in hospitals. So the HA has accumulated some experience. They are now more knowledgeable about the development of the disease, and they have to base it on evidence. Because at first this was a novel virus, but now both locally and overseas there is a wealth of literature on the clinical presentations and infectivity of the virus. There is more literature and evidence available for reference now. So they have a clearer picture. So in future, they will have more information on both symptomatic and asymptomatic patients. So in terms of the clinical treatment and treatment protocol and the arrangement of wards, I think they will know better which is the best arrangement. Speaker was off mic. Of course, we are closely monitoring the number of new confirmed cases every day. And certain categories of information is very important as well. First, the number of imported cases. For imported cases, we have Hong Kong students returning from overseas. We must let them come back. So when they return from high-risk places, the risk of infection is indeed high, and there is nothing we can do about it. And we also have to closely consider the number of cases with unknown sources. And it's worrying if we have too many such cases, and the figures do fluctuate. The Department of Health sometimes cannot trace all the close contacts of cases. As Dr. Zhang Zhukwan said, there may be links among cases, and sometimes the epidemiological links could be identified. There are cases where the source of infection is unknown, but for those that are known, we have to tackle these clusters, and that's why we have 2 regulations. And we really have to urge the public to ensure social distancing in order to break the chain of infection, to prevent a community outbreak. We must tackle this situation. Thank you.